The icing is fine. The icing is not going to change the swelling.
Okay.
You know, the icing is purely for sensation and how it feels.
Okay.
If you're not really experiencing a lot of pain,
Right.
I wouldn't worry about it too much. Use it if you want, but this swelling is just because this leg has been in a dependent position for a while.
Yeah.
You know, and so you get that kind of pitting edema in there. And the coloration looks good, the temperature looks good, like there's no real concern.
Yeah, I had, home care nurses
Uh-huh.
and they weren't concerned, you know, taking
Yeah.
the temperature. But Dr. True, Barb and I, and Mike a little bit, he said, I think you're all right, but to be safe, I'll do the ultrasound, which is glad of.
Yeah, always get it ruled out. So we're at 47 centimeters, right on the dot.
Okay.
Right now, what I want to do, now I don't have the normal wraps here, I've got them at the other clinic,
Okay.
but I would definitely encourage some compression wraps with the 6-inch wide ace wraps that are real kind of soft and comfortable. You probably don't have any at home, but that's okay because I've got 2 at the other clinic.
Okay.
But what I'm going to do right now is I'm going to use these wraps.
Okay.
They're not the right wraps, but they're what we have. So 47. Try and remember that because I didn't write it down. Okay, I'm just going to back this up a little bit. Let's go right there.
But you know, they kept saying, hold your feet up. Well, you can't do that first.
I like this topic. When I research the clinical data on elevation,
Okay.
specifically for swelling. So this is a little tighter than you're going to wrap it at home,
Okay.
but we're not going to do it as long, you know. So I'm going to have this on for like 10 minutes or so. But when you look at the clinical research on elevation, you have to be flat on your back. Your hip has to be at about 45 degrees.
My what? Hip?
Hip
Okay.
at 45 degrees or higher. Below that, you're really not going to get any benefit. So like a wedge, laying on your back with a wedge and the knee bent, you're not going to get any benefit really from that. It's good to do. It's better than nothing. But at the same time, it's just not going to give you the dramatic change that we're looking for. So when you wrap in the future, you're looking for about a 50% coverage. So you see those 3 lines,
Yeah.
right? So I come around
Okay.
about halfway. And it's just a spiral. And ideally, you're going to bring it all the way up, at least above the knee, maybe even higher than that.
So where you said that I kind of lost track of the spiral of the separation.
You're going to cover about 50% overlap. Every single layer, just
Okay.
spiral.
Okay.
You don't have to go tighter, you go the same compression
Okay.
all the way up, but it just naturally will funnel that fluid up. And so, like right now, this would not be considered obviously elevating the leg because the leg is below the heart.
Right.
But the compression and the gradient of that compression is going to help. So if somebody had to be in this position, this would work. I'm going to get you to use the recliner. We're going to recline. But before you do, just hang on one sec. So, got a bunch of moving parts here. So I'm going to get the leg rest out. And you can lay back for me. Go ahead and push that recliner back. A little bit more. Go all the way as long as you feel comfortable. Let's see if we can get you. Yeah. Okay. And then what we're going to do is we're going to bring this up. Right there.
It didn't hurt or anything. It just sounded like it wasn't going to.
So to put it in perspective, this still is not 45 degrees, right? So this still would not give you a noticeable benefit, but because we have the compression on there and it's day one and we're just kind of getting the ball rolling, getting you started, this is a good place to start. How does that compression feel at this level?
You know, I don't notice that much.
So that clock on the wall's at 75:30. I'd like to get 10 minutes in. I know it kind of feels like a little bit of a waste of time, you know, because you want to get moving and we'll do all that stuff. But I'd like to see if we can get some of this fluid moving back into the system. Just because, I mean, it is, I'm going to try and sneak this in a little higher. It is a little bit more than I would like to see. You can just relax. See if you just totally relax. Even if the toe rolls out, that's fine. I'll kind of adjust. What does that feel like?
Compression.
And just positioning and everything.
I'm comfortable.
Okay. It might get a little throbby. You might feel a little bit of a heartbeat, you know, in the toes. It's nowhere near too tight that I'd be concerned for 10 minutes. But when we take it off, we should see some improvement. So you just relax.